In the interest of time, let's go ahead and move on to the next phase of our program. And I'm delighted to, that Dr. Bob Baiocchi took on this trainee panel perspectives that we're holding right now. Dr. Baiocchi is the PSTP director at The Ohio State. I'll turn it over to him now. Rob?
All right, so let me share my screen here. Can you see that?
Yep.
Yep.
There we go. All right, good afternoon, and welcome to our first panel discussion. We're all here because we're obviously interested in growing and diversifying the physician-scientist workforce. So what better way to start than by hearing directly from trainees in the pathway. Our session's entitled Physician-Scientist Trainee Perspectives. We have three panelists, each from a different stage in the training pathway. Our first panelist is Jose Rodrigues. He's currently a 6-year DO PhD candidate in the Michigan State University College of Osteopathic Medicine. Serves as the president of the American Physician Scientists Association, or APSA. Throughout his service with APSA, Jose has spearheaded efforts to increase diversity in the physician scientist career path, including the Physician Scientist Trainee Diversity Summit, which was held in 2019, and the creation of the Justice, Equity, Diversity, and Inclusion Committee, which is now a permanent standing committee on the Executive Council of APSA. So thank you, Jose, for joining us. The next panelist is Bobak, who received his MD PhD in the Vanderbilt MSTP. He earned his PhD in the laboratory of Dr. Chris Williams. Is currently a second-year medical oncology fellow in the physician scientist training program at Weill Cornell Medical Medicine in New York Presbyterian. During his fellowship, he became interested in lung cancer and clinically and scientifically, and is currently in the lab of Dr. John Blennis studying EMT and lung cancer. And our third panelist is Ann-Kathrin Eisfeld from OSU, Ohio State. She earned her MD and trained in hematology and oncology at the University of Leipzig in Germany. After working as a visiting scholar under the mentorship of Dr. Clara Bloomfield and Dr. Albert de la Chapelle at Ohio State, she transitioned into our PSTP, where her research explored the genetic underpinnings of acute myeloid leukemia. She completed training in 2020, a year early, and joined our faculty as an assistant professor in the Division of Hematology, where she currently directs the Bloomfield Center for Leukemia Outcomes Research. So the way that we designed this panelist discussion is we developed several questions that we could get the perspectives from each of our trainees, as well as input from the audience. So to start, our first question is the training pathway of physician scientists presents multiple transition periods that at times can seem daunting. These are transition periods during the MSTP where trainees are clinically starved during their PhD training, and vice versa in the PSTP pathway in postgraduate. Trainees can be scientifically starved during the intense PGY years 1 through 3, where they're training in their residency and subspecialty fellowship. So I pose to maybe our first panelist. We can just go in order of each of these trainees. What are strategies to most effectively navigate these transitions? Jose, are you there?
Yeah, thanks so much for having me. Thanks for including trainee perspectives, and it was a really awesome talk by Dr. Abel and really great discussion. I'm not sure what the best strategies are. I tell you my experience so far, and I'll highlight something that APSA has done for some time, and hopefully we can get the results out soon. So that is we surveyed MD and DO PhD trainees and looked at clinical continuity specifically. And so we have some trainees who are writing up a a paper on perceived efficacy of their clinical skills throughout their trainee and the different strategies that their different institutions applied for clinical continuity. So hopefully that will give some really great insights in terms of what different programs are doing and what at least the trainees themselves perceive as effective. In terms of our program, we have outpatient rotations during our PhD, which is unique to, I think, our program, and maybe some others are doing that. It can be a challenge to do one day a week clinics, but definitely has helped me maintain confidence. And I think being very clear to trainees that it's okay to be focused in a specific thing at a certain time. And that has really helped me, is just knowing that you know, it's okay to just be really into science for a few years and it's then transition back. I think we often see people doing both things and as trainees, and maybe don't realize that, you know, it's very hard to train both things at the same time. But once you know how to do it, maybe it's a lot less difficult to do them at the same time rather than training both of the things at the same time.
Thanks. Bobak, are you here?
Yes, I'm here. Yeah. Can you hear me?
Yes, we can.
I just wanted to echo Jose's comments too, and just say appreciate the opportunity to be here and to give our perspective. And it's nice to see a lot of familiar faces, some faces from the interview trail over the past 5 to 10 years. I recognize. Kind of the big points I want to hit in response to this question. So I actually feel this very acutely right now. So I just kind of came out of the transition from my first year of clinical fellowship, where really I reset and had to, you know, a HEMONC fellowship in 2021 is truly another specialty. And even when you know what you want to focus on, like in my situation, lung cancer, it's just requires even a deeper sort of knowledge, and especially with all the exciting advances right now. So I really felt that transition, both starting intern year and from coming out of medical school. And then by the end of my second year of residency, I felt very clinically competent and felt like a pretty decently trained internal medicine physician. And then you reset for fellowship, and that was a tough transition. And by the end of my first year of fellowship, I felt fairly competent. And then I went back to the lab. And when I was finishing graduate school, you know, CRISPR was kind of around, but most people were still doing shRNAs. And now CRISPR is, you know, as common as anything else. And the other thing I remember vividly, and probably my proudest paper from graduate school, was we did RNA-seq on some mouse tumors, and you know, they were whole tumors, and it was really fun to analyze the data and all the networks. And I'm just now, the single cell RNA-seq is such a standard that I felt that gap very acutely of catching up to the science, and at the same time trying to expand and learn lung cancer clinically through and through. So I really felt that, and I still do. And I think the thing that I still rely on, and this was discussed a little bit this weekend at the joint AACI meeting, it's almost cliche, but I think you need a community, and that sense of, you know, diffusing your own stress and anxiety by talking to friends who are at other institutions or at your own institution or a couple of years ahead of you, or at your peers. So that's something I've continued to rely on, and I think it's invaluable to talk to people and for them to express how they're feeling and find it it's the exact same way you're feeling. So that's something that I have always relied on. I think one of the challenges, and I would be curious to hear from others, or especially other PSDP directors, one of the challenges that I've always found, and I really feel at this stage of training, is I think it's much easier to develop that sense of community in the MSTP phase, because you tend to be all in your mid-20s. It's a larger group, especially sort of the mid-tier programs, mid-sized programs. but when you get to the PSTP phase, not only by definition are they smaller, but people have families, they have a lot of other obligations. So I think it becomes a little bit harder to rely on that sense of community. And I think it's the most important thing that I've sort of felt to help buffer these transitions.
Great, thank you. AK, are you there?
Yeah, I'm here. Thank you, Rob. And also again, echoing, thank you so much for giving us the opportunity to be here. And also echoing what Jose and Bobak were saying. Many of the things that I wanted to mention, they brought up, but I want to immediately respond to what you just brought up, Bobak, with the community. That's not directly associated with this question, but in some way, that's the most important point that really lines everything up together. And I think we were in my year, we were a very small program with 2 PSTP trainees, but then keeping us together through the years, was probably the most important fact. But still, one had this kind of guilt when there are 25 categorical residents or also fellows, right? And one tried to do something else, so it's easier for oneself to try to blend in. While now that it's increasing in size, we have 4 trainees now, and it's even closer among the different years. That's something that I felt was very helpful, and that I hope that I can push on and tell the people who come in the years always behind me now that we as this group, and we can do this together, and it's okay to do it a little bit different, because it's a very different goal that we have if we want to become physician scientists. But the 2 things I think from the effective navigation, I think they both go together with the community, is for me, this is in very close mentorship, but I was very lucky to have very early on. And I think that was important that I was guarded from doing too many other things. It's very easy, I think, especially in a very involved residency program, to get sidetracked. Also with other research, right? Like research that is required by residency, but that again takes time from your very specialized research or from your interests, and finding a balance in between still participating and not going away from the bigger goals and from your own career is one part. And also, again, in line with that, for me, goes a very strong, and I'm curious what people think, expectation setting. I remember the hardest part for me was probably the transition from my postdoc that I did prior to starting residency, when I was a visiting scholar, to go back to residency. And most of my friends were PhDs, and meeting them at meetings, and the science I decided to do instead of residency was really clinical retrospective outcome studies, which is still my focus because I really learned to love it even more. But at that time, after doing so much basic cancer genetic research, I felt only like a half scientist, right? And to like change and say, this is absolutely okay. And if you achieve to this goal, you don't have to be in the lab. You don't have to be doing lab research in order to still advance your science in line with your clinical advancements, in line with the goal to become a great internal medicine and a great physician, whatever specialty you choose. I think keeping that in and telling this to the trainee early on, and perhaps even putting it into the perspective, hey, if you have these findings in your retrospective studies, this is a great opportunity for a young investigator award. This is exactly what happened to me, that with these studies in residency, I had the opportunity to early on put these grants in.
Yeah, thanks. That's one of the things that Jose mentioned is this idea that while you're in your science part of your MD PhD, to devote it completely to that. And I think as mentors, it's important that we really do help our trainees engage with both sides of the coin, focusing more on science when getting your PhD, focusing more on clinic when you're in those beginning years of the PSTP. But it's something I think that's being addressed at several programs. I know Jay Diaz up at Mass General has a very interesting program in the first 3 years of residency, of internal medicine residency, where they've built a scientific element into it. And we can perhaps discuss that in the panel following this. The next question is this PSTP versus categorical that seems to trouble many people finishing medical school or MD or DO PhD programs. This, you know, juggling whether they should be applying to PSTP versus just a traditional categorical, and how is it that we dispel this myth that trainees should be completely focused on clinical training during their residency period? This is actually a question that I believe Jose brought up. So happy to hear your perspective, Jose.
Yeah, I think at least in our program and from other trainees, there's just been at least this discussion of, you know, how much in terms of my application or this sort of focus do I really want to address in terms of which types of program to get into or apply to. And so there's this idea of like, do I just really want to focus on my clinical training and then do research and fellowship? Should I really seek out these programs? Is there a am I going to have some sort of detriment in my clinical training if I pursue some of these programs? I think at least for me, knowing a little bit more details about, like, you know, you have to be approved to in certain pathways by the board and things like that has reassured me. But just, I think Dr. Williams and others have addressed this too at AAIM level by having those webinars and really sort of allowing folks to get more detailed information about PSTPs, I think will definitely help for sure.
Bobak or AK?
Yeah, sure. I think I had, I vividly remember having this question and concern when I was applying for residency, and I knew I wanted to do PSTP, but in specifically oncology, and you know, this question always of 3 versus 2 years for medicine. And you know, I spoke to as many people as I could, PSTPs at Vanderbilt at the time who had just finished up their residency, and then a lot of junior faculty. And I think to a T, every one of them said, you know, it really doesn't matter that 3rd year of medical training and residency, you're kind of refining some things, and it's not that critical to being a good oncologist. And I found that to be completely true. I think by the end of your 2nd year of residency in medicine, I felt completely competent, and I was, to be honest with you, very much ready to go on to fellowship, because you really do just start to see the same things over and over again. I think it depends a little bit on what you want to do in terms of the fellowship. You know, for oncology, you don't really learn a lot of oncology in residency in some of these specialties. But, you know, things like cardiology and pulmonology, if you're going to be running ICUs, you know, you do a lot of that in medicine training. So I think it depends a little bit, but I remember having these concerns as well. And I certainly did not feel this, I did not feel like I was lacking in any training from a medicine standpoint when I started fellowship.
Thank you. AK, your thoughts?
Yeah. No, I completely agree. I felt so ready after 2 years. I could not wait in here. And I think probably for me personally, afterwards, the biggest negative effect, if I could say so, from not having the 3rd year was having to wait to do another year to do the AAIM board, because it's really not fun to do AAIM boards after 1 year of really strengthened oncology training. I think if there's one thing, and it really makes it, at least for me personally, made it almost more difficult to focus, to study for the, you know, the mock exams you do for oncology and really go in depth, and at the same time not forget about rheumatology and you know, all the good ortho stuff that they still throw in AAIM training. I don't know how other people feel about that. But I think also when you throw the question PSTP versus categorical residency, I see it also the other way around, that one can see more, we get a great internal medicine training, I feel absolutely ready, but also saying there shouldn't be this very, that's not really two sides of the coin, because there can be also categorical residents that develop a high interest in research they never thought they would have. Like out of a sudden, they have a research project they really dive into, and then have the opportunity, and that's great. We have a couple of examples and at OSU where if you have a flexible program director like Rob, really enables them also to do a lot of research. And I feel as more as flexibility you have and really go with the needs and with the interests of the trainee, I hope it then also bounces back to the PSDP trainees that that the myth goes away, that that we are impairing clinical training with these parts. And
yeah, that's a great point. We just over the past couple of years have been bringing in categorical residents into the PSTP. And while they're not doing the research pathway through the AAIM, they're still engaging on a regular basis with the program, getting the mentorship and getting the resources. So it's definitely a way to bring on board more people, late bloomers and people who had develop interests. So great. So let's move on to the third question. How is it that we create a robust and diverse physician scientist workforce? What can be done at each level of training, i.e. from medical school through PSTP and junior faculty stages? Jose, you want to start that one?
Sure, yeah, we had really great discussion from Dr. Abel on this earlier, and I was really excited to hear him mention the programs out of Boston from Dr. Joan Reed's program at HMS. I'm actually alum from some of those programs from high school to undergrad and college, so product of those programs, and so I'm a huge proponent of them and thinking about sort of trainee, thinking about the investment early on. So I thought that was really important in terms of the discussion of catching people early and identifying folks to give them the confidence to pursue opportunities really early. And I'll mention that APSA has been doing a lot in terms of supporting trainees from what we can do as trainees. So I like Jay's question, or Dr. Vias's question about if there's a database where can we go to seek out those kind of opportunities, and maybe asking your trainees about what programs they're engaging in is a good way to start. APSA launched the virtual summer research program where we try to pair trainees with others. And then we have a fantastic trainee who's working on what she's calling mini lessons for future medical scientists. And so they're like YouTube courses, and she had a connection with a Bronx high school teacher. And so she like zoomed in. So that committee of APSA is looking to partner with Zoom Classroom, or I think that's the name of it, was Zoom Classroom. And so doing some of those kind of activities with high school students. So, there's a lot of efforts there. And I think thinking about sort of like this longitudinal or like lineage mentorship is really cool. And I think we had some discussion about that at the meeting this past weekend, of some programs where, pairing a postdoc scholar with an early career trainee or resident trainee. I thought that model was really cool, and thinking about how you can bring someone up through the career path by supporting each other. There's benefit from either end of that mentorship. So I really love that idea of sort of this cycle of pairing a post-bac with a resident who might need support for their particular project. So
great, thank you.
Yeah, just to add to that, I think one of the nice things in the social media age too is being able to highlight faculty members or fellows or residents, and either just a quick interview or some way to sort of highlight that they are in these leadership positions, and so they're get broadcasts and people see underrepresented minorities in those positions, and they kind of have a role model to be able to say, oh, it can happen. Those are examples. And then in the Twitter age, if that happens, if someone is a profile is being discussed, there's an interview on Twitter, it's very easy just to reach out to them and to potentially create a mentorship, a relationship that way. So I would just, I think that's really important.
Yeah, I completely agree. And I would even go earlier. So following the discussion that we had before this panel, going up down to high school students. And as an example, in my lab, I have 2 students from underrepresented minorities from a great program, CRATES, and from a STEM part that's done at OSU. And those are being linked to the residents and fellows and do their, their pipetting and so on. And that has been now done since a few years. But in addition to keeping them involved and like really learning from each other, I feel also helped was that it kept them even more connected with the institution. So even trainees that would then go away for some part of their training, because they had not only the involvement with their mentors, but with different like stages of trainings at the institution, they then like at least interviewed or even like are considering to come back and at a later stage in their career. And I think that almost is like another question I always ask myself when I think about how one can be as robust as possible. I always wonder about the benefits and versus from each side of staying as long as possible at one institution. I certainly benefited from that, right? I was able to continue at least some degree of research throughout my training and then go right in and have all the resources I'm like in here versus getting inputs from other, from a change of an institution, having a new environment. But I can certainly see that other people who change, you always have this like run-in warm-up phase that you have in here, and finding a good balance between those two, is also, I think, very, very, very important. For me, the best way was that it was suggested, and I did it from early on, that I had mentors from outside, which I think was very helpful to get at least some out of OSU experience and so on with my very involved mentors in here.
Yeah, and just to take off on a point actually brought up in Dr. Abel's talk, and then what's happening at Ohio State. One of AK's students actually has helped us this year with a longitudinal program we have with a high school on the west side of Columbus. And he has actually provided lecture and serving as a mentor this summer to some of these high school students who we're very focused on becoming scientists and very interested in medicine. And so it's really exciting to see the trainees within the program wanting to be actively engaged in mentorship of younger students at high school, undergraduate, and medical school. And it's something that can be organic and really just drive itself. It's really exciting to see. So yeah. Let's see, let's move on to the next question here. Sorry, I have the chat open. So this question was actually, I swapped it in the last minute because Jose had sent me a slide that we'll share at the end of this session discussing at the trainee level the thoughts on trainee attrition and the pathway and what can be done to effectively retain trainees. Jose, maybe you can talk a little bit about that session that's coming up and other thoughts.
Yeah, this was a slide sent to me from Dr. Kwan and Dr. Nak, who are our committee chairs for the Resident Fellow and Junior Faculty Committee at APSA. And so they're sort of early career physician scientists, and they were really thinking about how we as an organization can support this cohort. And Dr. Kwan specifically wanted me to share this with y'all. And we have these 2 surveys that are coming out to address this. And maybe we can distribute this to the PSTP directors through email, but really thinking about, at those critical transition points, when folks are looking for a job, how do we really help folks to make the decision to maintain research. And one of the things that Dr. Kwan had sort of educated me about was the, difference in compensation. And so that can be like a huge factor for folks. It's just simply easier maybe to do the clinical work and get paid more to do it than launching a research program sometimes. And so I think, I'm not an expert yet in that, but I think that has maybe others can speak to that and whether that really is a sort of a driver for folks at their particular institutions. So.
Thanks for sharing that slide. Bobak, what are your thoughts here on?
Yeah, I think this touches a little bit on the number one, but I think at least this is in my experience and talking to friends and colleagues who are in similar places, but I think you always feel that pressure of leaving this pathway at the transition points, and especially when things aren't going well. And usually that's, I think, in the lab when the highest risk for that. I didn't appreciate those pressures as much until I got into sort of this phase of my training. And in particular, because I think as you get older and thinking about family, or you have a family and start to think about cost, I think that pressure increases. And, I've always considered myself, I've sort of always wanted to be in academics. I feel very lucky to have been gotten into an MSTB program and be where I am now. My family kind of has a history of academics, the lifestyle. I enjoy it, the science, obviously the privilege of being a doctor. And I never thought in a million years I would feel that pressure. And I certainly do. And I especially felt it when things weren't going well in the lab. And when things are getting exciting again, it's a little bit less. But I'm also getting married in a few months. I live in New York City. So, it's almost impossible not to feel that. And that's even with having my medical school tuition paid for by Vanderbilt. I don't have the debt that some of my other colleagues and peers do. So I think that's a really powerful pressure. And I think that the best way to combat against that or to inoculate against it is, again, going back to this concept of, a community and mentorship. So, I think if you have mentors that you can look to who are really enjoying what they're doing, they're sort of living what you were thinking about, which is seeing patients and being able to study that disease in their own lab. It gives you, puts wind back in the sails. So, I think it's that, again, just relying on that community and having that mentorship is critical.
Yeah, I completely agree. And for thinking from a nutrition, like I feel there are these two, like really, like Bobak also said, like these different driving forces, right? Like that you think, is it still the right thing for me to do? And I think what I believe one important factor besides this intrinsic wanting to do that, which I feel everybody of course wants, is of course success, right? If you're successful in what you do, if you get your papers out, you're probably less likely to leave. But the other part is if you do that, everything else, because we are older, right? Not only me doing this whole thing twice, the residency in here, but with everybody, so many have their MD, PhD, so many going in these pathways are, from an age also behind. And so it is very appealing then. And I've seen that from many of my friends I'm talking to who then think really, oh yeah, I've been doing this for so long, but it is this financial aspect also that Jose mentioned. And I think, again, the best thing to probably drive it away, at least when I would reflect on myself, that it didn't, that I wasn't caught away by this aspect, was that people at my institution or even at others were recognizing or, you know, giving, you know, you always feel like underappreciated in what you do, right? But saying, you know, actually you did a great job, and we think you can finish your training early because you have done a lot of research. Yes, you're only junior faculty, but we appreciate that you did a lot of research. So yes, you can have a more responsible position even in junior faculty. And I think what may be helpful in another way is if for example, the scientific communities, and I talk about is like the American Association of Cancer Research, or like, you know, the big organizations, if they help to include physician scientists early on, to also give them a recognition of what they do, because I feel this is also then sometimes perhaps what makes people less likely to leave the pathway, if they see that people believe in them, you know, on a national level and you know, at an institutional level, and all of those things together, right? At least I feel that what always kept me on track, besides my love for what I do, you know, but I also love seeing patients. So I really can see it from those.
And just to add to that real quick, you know, I think another one of the financial pressures are there, but like AK was talking about, there's the pressure of sort of feeling competent. And I think there's that pressure, I think, on PSTPs is unique. It's three-pronged. One is you feel the pressure of really being a good clinician and being up to date with all the trials, because otherwise you feel like you're doing a disservice to patients. You feel the pressure of being a good scientist and making meaningful inroads into you know, problems of disease. And then I think the third one, which I'm definitely becoming much more acutely aware of, is, oh, in a couple of years, if I have my own lab, do I have the expertise or competence to mentor postdocs and graduate students? Because I mean, and you feel like you're doing a disservice if you're not that you know, accomplished or knowledgeable about it. So I felt that I recently have spoken to a couple of other junior faculty about that problem, and they were very helpful and sort of reassuring, saying that's a normal thing to feel, and suggested some strategies for it. But those are really powerful pressures, and you know, I think those are things that we sort of have to encounter often.
Yeah, thank you. I think that the chat is kind of reflect a lot of good discussion between Patrick, you and Olu, and Jen and Chris. In particular, Olu's comment, as a community, we need to reconsider our approach to attrition. Presently, pathways to reentry are virtually non-existent. If there are multiple entry or reentry points in the pipeline, we can readily boost this physician scientist workforce. And Chris had mentioned here the NIH LRP program is a terrific mechanism to forgive medical school debt. From a finance standpoint, it's a really great opportunity for physician scientists in training. And Patrick's, you know, identification of the key areas where we're seeing the most attrition. You know, these all give us areas of focus to really direct and develop programs to retain people. So all great perspectives. Thank you for all that. We're coming up on the end of our time. We have one more question that can be discussed. This is about the training time in the pathway. And it can be viewed as long and arduous, and what can be done to shorten training time, to expedite transition into faculty positions. What can be done about the mindset? This is a longitudinal, you know, never-ending pathway. How do we get that point across to our trainees? So interested in hear what you have to say about this.
Yeah, I'm still struggling with that myself, right? I think recently, I think it's really, you know, there's definitely like systemic things that can be addressed, but also just as in like, there's also as just like an individual. And I think I definitely struggled with this. Like my life will start during residency, or my life will start during fellowship, and like just putting things off, or you know, oh, I'll fly back home to see family after I finish this paper, things like that. And I think maybe as directors of MSTP specifically, if we identify those kind of behaviors in your trainees, maybe trying to sort of dissuade that and think, look, you know, your life, this is a professional pathway and your life starts. And so I think personally, I have definitely changed my own perspective. So there's definitely part of that is at the individual level, but I think, you know, understanding that, you know, trainees are going through 8 years of training and then see, you know, 3 to 4 years or 5 for residency and then 3 additional years for fellowship. And then, oh, you know, now I have to get a job. I think that is really daunting. So being aware of those programs that can shorten training or integrate those research pathways and knowing that folks are really looking to recruit you to their institution has really sort of given me confidence that I'll sort of maintain in the training. So I think, again, you know, highlighting the work by the AAMC and talking about those different options for shortening from my perspective is great. But I'm not sure if others want to comment on sort of work or other programs that can shorten that training.
Yeah, I think at least from, you know, my experience still being a trainee here, I think I don't think medical school needs to be 4 years, and I know a lot of programs are changing that if they haven't already. And as I mentioned before, I certainly don't think internal medicine residency needs 3 full years of training. I think the perspective I'm in now, which is in the postdoc phase, it would be nice if there were sort of more funding mechanisms. There obviously are a number, and I think in the cancer area, they tend to be very competitive. So those are always helpful. If, you know, easier time essentially obtaining funding. And then the other thing, which I think people are touching on in the chat, is the thing that has sort of been hammered into my perspective and sort of been told by a number of people is, you know, getting the K, you really need a first author paper. And that's kind of tough to do, and especially in today's age where, you know, reviews can take 6 months to a year. So that pressure feels like it really kind of stretches out the training period as well.
You know, just to quickly jump to the chat here, Patrick brought up really great point about case study sections and how they need to be educated with specific types of applicants, you know, in a physician scientist training program. And you know, this is something that is problematic to require that everything's laid out for people, that they have lab space already. They already have a first author or 2 first author papers. But these are all great points that I think we as program directors need to maybe get on these study section reviewers, as you know, to try to introduce that to these study sections. So AK, your thoughts?
Yeah, I completely agree with what was said, and I think it's all about, like with most of the other things, it's about flexibility, right, of the individual program and even on a larger scale, to see what do we require, what does my PSDP Chrome, what does AAIM, what is required to finish this pathway, right, and to move on. And from it was I'm so grateful that for me my mentors and also you know, my program said after, like, I finished after PPY4. And I think all these flexibilities to go into and said, oh, you know, you did a lot of research, you had your publications. Of course, I didn't have a K, right? Of course, I didn't have the part that would go into that, like in here, but I had some other awards that I was lucky to get, and I really benefited from people taking me out of the pot, right? And then saying, hey, but yes, we believe that you are at the point where you can have your own lab and where you can do your own research, and you have shown that you can do that instead of keeping this on longer. And I knew this basically then a year before I was done, and it was such a booster also for the motivation. And I think if people know that this is possible, that that there's flexibility in what you can do and what you can achieve, and as I said, even more for study sections and so on, that you don't have this pressure in here. Then if you know it's possible, it will happen, and then you can work so that it happens to you too. And if mentors know, they can send the letter to the AAIM and say, hey, the requirements were met. Why shouldn't you? Like, why shouldn't he move on? And especially, I can also bring it up, like in this part, it was incredibly critical for me as a woman, for my family planning, for all the other parts, having this extra year and having this extra part. I think this is something that also great attrition for me, right?
Thank you. There's a great point here that Jay DS makes in the chat. He says, we've watched in one generation a fundamental switch in the K mechanism. Study sections have now consistently rewarded achievement. They used to fund promise, and it was a mentored award. Now it's a pre-faculty requirement, and that's such a good point.
Yes.
And it's something that we all need to be mindful of, I think, when we're serving on these study sections. So, well, we've reached our 45-minute time stop, and it's been a great discussion. Jose, Bobak, and AK, thank you so much for your perspective. This is great for us to hear, and we really appreciate you joining us today. And I'll hand things back over to Chris or whoever's taking it from here. But
thank you, Rob.
And thank you for all the great comments in the chat too. That was great.
Yeah, I too also want to echo Rob. Really a terrific discussion, and thank you, Rob, for moderating that. That was really a terrific and very enlightening. Really do appreciate those comments. We'll continue